MPCA was directed to do. Those of you that were at AMC District 10 know this is a big, big issue and a lot of concern from all of the counties that are really engaged in solid waste. And so Jake and Kate are going to walk us through this letter. So Jake, if you want to go.
Yep, so Commissioner Brennan shared a few weeks ago the, whatever it was, 350 some page resource management report that the state agency put out. The MPCA is accepting comments, public comments on the letter until July 7th. So based on, I think following the conversation Leslie mentioned at District 10 last week, we put a comment letter together. I modeled this on the Imagine 2050 comment letter that we brought to the board a year and a half ago, where this is the board sort of at a policy level letter, and then Kate and her team will have the opportunity to add technical comments, just like Craig and our transportation team did with the Met Council letter. I'll just walk through it. So highlighting that we care about solid waste in Scott County. We're not a bystander to the system. We have DEMCON, we have Dakota Prairie here. We understand the hierarchy that's been codified in statute. This, the legislative charge that directed the MPCA to create this is just relatively clear. This isn't a policy document. This is not binding for anybody. But as Leslie has pointed out, that state agencies, the Met Council, have used opportunities like this to gather some public input, to put something together to assure everybody it's not binding, we're listening to everybody, and then that ultimately either becomes the policy or deeply shapes the policy. So we want to make sure, even in this sort of, it's open, we're just writing a report, we want to make our position stated as strongly as we can. And I should have started with this. This is a draft. So the intent would be to bring this to the board and an RPA at the July 7th meeting and formally adopt the letter and then submit it that day to the state agency. So we have a couple weeks to reshape this. And commissioners, your input is absolutely appreciated on this. So as I read through the report and the legislative charge behind it, I thought the most alarming thing to me at a policy level was that the report over and over and over ties landfilling and waste to energy together as forms of disposal. And the waste hierarchy currently does not do that. Statute, waste to energy is considered resource recovery in the hierarchy. It's not considered disposal in the hierarchy. And over, the report ties those two options together. Kate, is that a fair description, a non-expert description of the waste hierarchy? That waste to energy is resource recovery from a statutory or a hierarchy standpoint, not disposal.
Correct. Yes.
Okay. And fair to say that the report, I think our letter tries to say it has a kind of an anti-waste to energy perspective.
Well, I think, and if I followed the discussion at District 10, it really puts one of our partners in a very poor position to be able to even comment. It doesn't even talk about the energy that's provided to Minneapolis, right? I mean, it just kind of glosses over.
Right, so when I first started to read the document, and I was doing it in the way I felt like the author intended it, so I was getting into the 90% that were trying to get higher up into the waste stream. And then it wasn't until I read Jake's letter and then I was hearing from other partner counties about this whole way they're associating landfilling, they're equating waste to energy with landfilling, and I was taken back because I'm like, well, no, hold on, wait, I just read this report. I didn't see that till I went back. And I thought, oh, okay, I have to completely start all over because I understand the intention wasn't to do that, but that's, unfortunately, that's what happened. So now I get to read it twice.
Why are you convinced the intention wasn't to do that?
Knowing the staff and how they feel about waste energy, I feel like their charge was to create a model And how would we do this 90% diversion and get everything up into prevention, reduce, reuse, recycle? I really felt that that was what their focus was, is up higher on the hierarchy. I don't think they meant to say that waste to energy is equivalent to landfilling because they so strongly believe in the hierarchy. They need to go back and rewrite their report because that's not what the report says. The
Correct.
report just says waste to energy and landfilling are disposal, period. True, waste to energy is a method, it's one of the methods of disposal, but it is much higher up in preference because it can provide a renewable energy, right? So I get what they did. They just did, let's just do 2 big buckets, right? Our reduce,
The
reuse,
bad
like our
answer.
3 Rs,
Correct.
and then this, like, the lower where we don't want it to go. I understand their mindset, but when you stop and you learn what other folks might try to do with that, the impact is awful. So that's why the letter is very good. Like, okay, I don't, to say to the staff, I don't think you realized it, but you accidentally redefined waste to energy. And I went back and I looked at Jake's comment. Yep, they accidentally redefined waste to energy. They're gonna have to go back and fix that. But I don't feel that was, when they started with this model, that was their intention to do that.
Okay. I think other people do believe it was the intention, and they were highly influenced by certain people within the community that was the intention. I would argue, this is where the Met Council discussion came into play. They can say they came out and talked to Scott County, right? They sat here with us.
Yeah.
But what was our comment letter? Thank you, thank you, thank you. There was no change, no updating, no concern from that. I think this actually needs to be stronger when I read it. I mean, they actually talk about anaerobic digesting is the brand new center that's gonna be, it's creating nothing of value. And our understanding, it is creating value.
It does, yes. So let me go back to, let me restate something I said when I said I don't think that was the state staff's intention, the ones that are putting this model together. I don't think it was, and let me just say this, I hope it wasn't. Maybe you are right, because when I went back through and I looked at it, just remember the first time I went through the lens of what does Scott County need to do to get to where we want to go, right? As I should. But then when I went through it with another lens after the AMC, I was like, there's some additions in there that I'm like, I don't understand why this addition was put in there unless they were influenced to do so.
Yep. And that's my fear, that this report was written in a way to set up legislative activity for the next 2 years. And because that's what will happen is they'll take portions of it and say, see, everybody's agreed this is true. Or we need laws that say this, or we only are going to put investment in this versus this.
Yep, so I would just say, like, I didn't see it the first time, because I hoped that the staff had done their job, as I know them to do well, right? And then when I looked at it from a different lens, I'm like, I don't even know why this whole section is in here.
I think they were very clear in their introduction that this was not a mandate. And I think that leads you to believe that it's not a mandate and what they're saying. And they're saying, oh my gosh, it's going to take a lot of money to do what this report says. But I think that, you know, we do have counties that are really focused on waste to energy. And I think that there's concern from those counties that have a higher focus on waste to energy. And I think there's also concern that the advocacy groups are going to come in and start saying, well, this document says this is how it's going to be done, or should be done, so why aren't you doing it?
Right. Your own document says it's bad. So my fear, if I get real parochial with Scott County, is that if we continue conversations with Blue Earth, with DEMCON, with whomever, and we find that that's a good route, permitting, funding, like, so yes, I'm thinking big picture too, and yes, we should just do the 3 Rs and move higher up the hierarchy. But I think this report would hurt us in Scott County as we go forward for that. So that's why I would like this letter to be strong, even though that we don't know that's where we're going, but I'd like some, I think, I want to support something that's going to cut back on our options to do better.
I don't know if I read anything new. I mean, I think these are all things that were already presented and
So let's-
discussed, other
yeah.
than the tie of waste to energy and. like-
Yeah. So let's take a step back from the whole waste energy issue that would definitely, that's the elephant in the room. But let's just to this at the end. But let's when I look at the document as it was maybe, as I hope that the staff intended to write it, what did we learn? So overall, because when I put in there overall, it's a fine document. Because overall it gets into okay, if we were gonna do the like I said, take away the waste energy, we're just gonna focus on the 90% diversion. And it talks about okay, how many tons would that be? So statewide, we'd have to collect 2 million annually, okay? 1 million needs to come from commercial, institutional, industrial. And so from where I'm sitting and what I need to do with Nick every day, that was a huge highlight. We need to be focusing on our commercial industrial. Did Nick and I already know that? Yes, we did. But it was nice to see that they were backing that up. So I agree that the things that I highlighted through here and what we're gonna have to, what's the tons we're gonna have to collect? What are the gaps? How are we gonna to get to that tonnage? What would be the programming? What would be the infrastructure? What would be the cost? Who would have to do what? It's in there. I don't think that, I walked away with something that was completely new to me. It did support a lot of the things, but I just want to go back to, although this may not be new to us here in Scott County, the Metro County, this is a statewide document. So there's a lot of people who are going to get into this document and they are going to learn a lot because it's statewide. The Metro is much farther ahead than many counties. So you have to keep that in mind too, who the audience is. It's statewide, it's overall, it's looking at infrastructure needs. Does it get into the exact location? It gets into it gives you more different types of facilities we need, approximately where they should go. So it's starting to get into there, for the Metro, we kind of already know the number and the location. But if you were central Minnesota, this might be new information to you, what you need. So it does have some good information in it. It should be used for information only. It should just be a planning tool. They state that, but I am now concerned from what I'm hearing from others that some people might take advantage of that, and that's not how this should be used, is to turn this into band-aids and statutes or even policy.
This will be used for people to move legislation forward, and it will be used as, look at all the people that commented, and there will be no responses to people who are in government and have to make fiscal responsible decisions. It'll get just fluff over if we get anything back at all, and they will move it forward as legislative pieces. I mean, part of it is they don't discuss what it's going to take to create these 381 businesses, right? And are they livable wage jobs, and will anybody survive at it? I mean, they're making huge assumptions that they don't even talk about the cost of really creating when you read through it.
No, correct. It stays very high level. It does not get into that.
So for the
It's academic. I mean, it really is an academic discussion, not a boots on the ground, which is what they will transition it to.
right, not a policy and then the policy
Correct.
in real communities. So the 5 bullets on the first page, the subsequent 3 pages really just elaborate on those 5 bullets. So those 5 bullets are the main points. Leslie has said we need to come out stronger, I think especially on the waste to energy piece. Just from my perspective on this, they're not asking for support or opposition. This is public comment. as much as we can sit here and speculate on who was behind this and what
Right.
special interests are driving it, I don't think that has much of a place in the comment letter because that is just speculation. I think it's dealing with the reality that is ahead of us, that whether we like this, whether we think the staff did a good job or a bad job, whether we think the staff's motives were pure or not, the reality is this document is very likely to be used by special interest groups to shape policy, and that's what, at the board level, not the technical staff level, but the board level, we just need to have a policy comment on where we stand on this, and then do, I think what we always do is work behind the scenes with our fellow counties to get an alignment, and if they're willing to submit any public comments on this as well, because they, at least in District 10, have similar concerns based on what I heard from you, Leslie.
Oh, this was a big discussion at District 10. It's probably one of the longest items discussed there.
So any specifics on parts of the letter to strengthen or points to hit even harder?
I like the 5 bullets. I think that's good to have them in the front. I would try to even make it less words and stronger bullets. And then my only other comment is, I think at the end, we need to make our ask. It's not just considering these comments, it's to revise
Correct.
the report. Taking, so I don't have any substantive changes, but I think we can be less wordy. I think we can, too many words because people aren't going to get through it. There's not. And those bullets strong and ask, a true ask.
And Jake, I would say our experience is documents like this eventually become policy and law, and this document needs to be revised to allow opportunities for the entire hierarchy to operate. I mean, however you word it.
Do we know if other counties or AMC or other organizations are drafting a comment letter like this?
I have not heard anything.
We have a solid waste working group, AMC, and I think that the call was, to write a letter, review it, and that's statewide. Counties were there, so it wasn't just the metropolitan area.
I think Ramsey and Washington are definitely sending comments.
Yeah.
I walked away from that at that meeting. I don't know. I think Hennepin is stuck. And I don't know about Dakota.
Once we finalize it, is it appropriate to share a letter with our neighbors? Because I know sometimes that can help spur additional action. Both ways, we sometimes see that. So if appropriate, if you guys deem that appropriate, I think it's great to share. Jody, is there anything in this letter you didn't agree with? I just know you've reviewed this in more detail than I have.
Hey, sorry for the connection issues. And so this may have been brought up, but the District 10 meeting was talked about quite a bit. And people had mentioned that this is sort of already being represented as maybe not gospel truth, but certainly not draft. So whatever we can do to really hone in on that to make sure that people realize that this is being taken as not a draft would be very helpful as well. I don't know how you word that, but I think that's important to really be strong on all of these points.
It's not a mandate. Is that what you mean?
Did you hear Jody, Dave?
Say that again?
Commissioner Beer, can you hear Commissioner Brennan?
Are you
I
saying
did not. I heard.
as a not a mandate, or is that what you're saying? That this isn't a mandate, or?
Well, the report itself, it was represented, so it's I guess opinion or speculation that this report, I don't know, because of its size or that it is draft, right? We know this is draft, but the folks at District 10, a few of them have talked about how people were representing the current report as not draft form.
Correct.
So, Yeah, so I just think it's important that whatever wording, less words, I hate to say it, but we've all been down there and you've got 30 seconds to really make a impact. And we had the leave behinds, of course, which Barb was talking about. So whatever we can do to make it stronger and to make sure we emphasize the fact that report, this current report is just draft. It is not gospel truth. And there is time to change. And I think it's being represented as the exact opposite, which I think we need to probably really point that out in our comments, and hopefully have others do the same thing. That's kind of the beauty of the AMC idea, or the consensus, is to make sure we're all on the same page as best we can, which I think that majority of us will be.
So to strengthen the request that this document be revised to reflect some of the things that we're talking about, and not just rubber stamp it and move it forward as is.
Yeah, and I don't think we want to, yes, we want to compare with our neighbors, absolutely. I just don't want it to appear like another form letter that we seem to be getting, where it's like, okay, you see the exact same thing, the exact same, and which I know we wouldn't do that. I just feel like I need to say it anyway. Yes, compare. Yes, hone. Yes, be strategic. Rifle shot versus shotgun, but not like obviously exact.
Got it.
Okay.
All right, the next thing up is to review a Farm Bill comment letter for next Tuesday, or the 7th action that Commissioner Berkey requested at the last board meeting.
Yeah, so Commissioners, Leslie, I think you already have the letter. I'm passing copies around. So this is a letter to go to our two U.S. senators in alignment with my understanding from Barb on where AMC and the state are at, asking for a 2-year delay in the SNAP admin benefit cost shifts enacted in HR 1. Much shorter letter, pulled from our legislative priorities last year, that we're state supervised, county administered. We're one of 3 states in which county property taxpayers get to cover the non-federal share. We have some projections of the costs. They escalate over time. I think it's relatively straightforward. You have an opportunity to read it. And we have time again to strengthen it, unless we think there's some urgency to get this submitted before the 7th.
2 questions on the solid waste letter and this letter. Are they going from the board, signed by John? Is that the plan?
That's the
Signed by
plan
the chair?
as I
Okay,
understand.
thank you. I just wanted to understand who
Yep.
was sending the letter. I hear it'll probably be the week of the 7th that we'll get the markup.
And they had heard the representatives from AMC that were out there last week. I heard from Klobuchar's office, don't be surprised if there's not language in the farm bill when it drops. It will have to come through as an amendment. And I think there's still some hope that there will be an amendment in here.
Yeah. My only thought, I think it's great. I think it's great to keep it short if we can keep it 1 page and just hone in on it. I think we should be CCing the record. I mean, because once that hits, of course, they're going to be doing hopefully get something in, but I just think since we've been talking to Craig Fischbach Finstead about this, why not send him the letter?
Yeah.
Why not send everybody the letter? We keep hearing noise matters, let's give them all the noise then.
We are.
Do the feds want some information from Minnesota on this SNAP stuff? And Minnesota's not giving it?
USDA wants the list.
The people that are
Receiving.
wanted it.
And is that over, or I just haven't heard that now. I feel like that was
Yeah, I had heard more noise, I guess, on that back in December, January. I haven't heard.
I heard it this morning.
Oh, you did? Oh, interesting.
from who?
On the radio saying they want the list in Minnesota, we're not giving it.
Yeah, I mean, when I went to USDA in February, that was the big deal. I kind of thought that was over, but yeah, I don't know. Are you advocating that I think you're advocating, should we be sending a letter to Ellison and DCYF to release the list? But I think Barb probably has some thoughts on whether that's a good idea or not.
Yeah, I mean, I don't know if they've been pretty grounded in that, not wanting to include that information and sending it. I know DCYF was out there speaking with the Senate and the House last week. I think we probably got more traction from counties speaking with our state. I actually feel like we probably have a little bit more sway than our state
Partners, yeah.
Yeah, so.
I'm just asking if that's what you're
Yeah, I don't know, I don't know why the state wouldn't give the list. I don't know, shouldn't it be public to the federal?
What's the state's response?
Yeah, and I can get the actual response on that. I believe that there is some data privacy protections on that, and that's why. But I can get you the specific detail and the specific state position on it.
Yeah, I couldn't remember it because it's been so many months. Was that if we release a list, then we're gonna get sued for this much money, but if we don't release, I think it was that, right?
Yeah, I
Like kind of we were in a gotcha situation. I don't know.
I'll find out.
So it sounds like the 7th would be an acceptable timeline, expecting that the markup will come out then and this wouldn't come forward until the amendment process anyway.
Yeah, I mean, there's a chance that the bill could drop this week, but it's gonna have to go through the amendment process, so. I don't think it.
Yeah, I mean,
I think it's still gonna be in play.
right. I don't know if we're gonna get any new information, so.
Yep.
This one's probably a little bit easier than the solid waste one because it is what it is. It is costing us that much money. True. It'd be nice to be treated like Alaska and not have to pay that much money. You know?
Right. Sure would. There was some talk that they're gonna have to find the offset savings on this. And there was some conversation that maybe they would find it by increasing the penalty percentages in years 3 and 4 if we delay for 2 years. So.
What do you think about that? My gut is fine because I don't know what the world's gonna look like in year 3 and 4.
I don't either. I mean, I think we have a chance to actually organize around the payment error rate
Right.
and really try to.
We can get better.
Programmatically do something about it. And so I guess willing to take the chance, right?
Yeah, I mean, that's what I'd say too, because yes, we should have errors, you know, where we should get down to as few errors that as much as we can control if there's not there.
Yep.
So.
Right, and we heard some things yesterday that maybe there's some interest in, even on the federal level, like from Fishbox office, that like maybe we need more federal money for system modernization here because we have such antiquated systems. And like, even though that got passed a few weeks ago, like nothing's changed for our staff. They're still working hard, same system, so.
Hey, quick question if I could. That's interesting. You talked about the red team. Did that come from Fishbox office on Systemod potentially getting money? But my question was, or go ahead, answer that one.
It did. So, like, we have this merry-go-round of folks in DC. I was there early, me and Jenny Mojo, then Steve was, then the Maxa folks were. Steve Schmidt from Meeker has been working pretty close with Fishbox office, and there's some posturing going on with her being like, well, the Democrats say this, but she's the one who brought up and says, well, maybe I could champion for getting more money for the modernization. Maybe we could it's still pretty pie in the sky, but at least she's saying that, or admitting that. Granted, you know, her and Vincent were in the legislature during the times that these systems got bad. She knows. She knows how bad it is.
And what the real question was with the letter, are we getting any reads on the red team on advancing this, or does this letter actually just kind of confirm what that maybe they're trying to do with at DC at the HR1 bill with at Minnesota trying to, do a bit of damage and push out people that aren't eligible.
Yeah, I think I understand your question. I don't think DCYF is forwarding this ask at all. This is coming from a county ask, and I think there's, frankly, just because Klobuchar and her position on this committee, and she's, bargaining with some of the red team on that committee who needs more money for New World Screwworm. It's just bargaining going on, and my thought in this letter is it's not saying anything. This is just all true. It's going to cost Scott County taxpayers this much. I think that sucks, because why should we be paying for a federal benefit program that we didn't create? And asking for a delay to help get the air rate, that even if our air rate's 0, remember, we're still paying this. So we need the whole state to get there. So I don't think we're just poking a bear at this or doing anything politically to be on one side or another. I think we're giving the A committee right now, senators can say, I've heard from this many people about this, let's look at a delay. And what Barb just said is so true. Even if they consider a delay, they're gonna pound us years 3 or 4, but I'm like, who cares right now? Like, that's better than next year. Let us try and get these air rates down.
Yeah, I got the sense yesterday that there was more hope, that there's a possibility, and I think for exactly what you said, like oddly, the screwworm and the southern states are really, they're needing to have an appropriation, and so in order to balance that, it sounds like the same amount that might have to be appropriation for that mitigation is the same amount that's needed to mitigate this problem. And so it's being discussed at least, which is probably more hope than we've had.
If you haven't filled your freezer with beef, I would do it immediately.
Yep. True.
Did that answer your question, Dave? I feel
Yes,
like
yes.
we don't want to be, I don't think we're being too partisan with this letter, if that's the question. We're not poking either side.
I don't mind a little poking on both sides, that goes, but yeah, you got the gist of what I was asking.
Anything else? All right.
All right.
I'll revise the letters, and they'll be in the packet for the 7th.
And if you have thoughts before that,
For sure.
email us and get them to us so we can include somehow in there. All right, next thing up was school attendance, and this is on here. You had the update at Scott Delivers, which was very well done a couple weeks ago. And this is about the RFP that we got in and a proposal to take a look at, and then how do we move this forward so we're ready into the next year.
Yeah, so I'll go pretty quickly through some of these slides because I think it's just a refresher from Scott County Delivers. Why attendance matters. Regular attendance predicts academic success. Chronic absenteeism increases long-term risks for kids. And early prevention improves our short-term and long-term outcomes. So moving from reactive to proactive, this is our school attendance programs are really a big part of that prevention culture and responding earlier to improve our outcomes. And the shifts from punitive to support school engagement, having the right dosage at the right time. And it's central to the statutory child welfare mandate, which us and other counties who implemented our prevention strategies for school attendance really led to the statute change in 2025 for a child welfare response to educational neglect and truancy. Before PASS, schools intervened with students missing schools. It was really about sending letters, doing detention, some of those efforts, and then when the exhausted efforts really came to us and wanting us to take over for that additional punitive response of filing court petitions, kids in deep end child protection systems. Those were educational neglect. It was assigned to child protection, and approximately 20 to 25% needed ongoing child protection case management. And then truancy was managed all by one worker who did outreach, case management, and triage with schools. And really in both systems, like it was was a little bit of a mismatch in how we triage cases. So in our educational neglect system, could be a challenge for child protection workers with cases that had higher priorities, in some of these cases not getting maybe the attention they deserved. And also with truancy, with the amount of cases, it was difficult to really reach every family's needs. Alternative ways, so our PASS program, students under 12 and their families, we have the contract with St. David's. Prevention, it enables schools to refer directly to St. David's when a student has 2 unexcused absences, trying to get ahead of additional absences. And then the diversion program, school makes a report to us, and then we refer that case to PASS diversion at St. David's for intervention support. And then our promoting attendance through Hope, our PATH program, 12 and up, goes to the Catalosor Treehouse. And then PATH provides early intervention and intervention for teens struggling with school attendance. Our outcomes, we've really been able to directly reduce our deep end system involvement. Our educational neglect assessments have gone from 48 to 11. Our truancy referrals, 61 to 32. I will say this year was a little bit of a challenge with, I think, more truancy cases than we had expected with PATH. Treehouse had quite a few staffing issues, and then they have decided to no longer provide the truancy program. So had some challenges late in the year when their staff left and handed over some of those cases to us to service those families. PASS diversion returning to CP is about 4.7%, and then 14% in 23-24. I will say the 23 and 24 numbers are a little bit higher with really those same kids from 2023, just really some of our most challenging families. 80% attendance improvement in these programs, 85 increase in protective families or factors for our PASS families, and really has been able to look at how we've reduced our racial disparities and culturally responsive practice, which is aligned with implementation of the Act.
I should know this from last week, but those numbers up top, like 48 were the number in 2022 and 11 in 2025, right? Yeah.
Yes.
61, 32, with probably trending downward in between. Okay, thank you.
And then the risks of PATH and PATH end. So we really be looking at a rise in educational neglect and truancy referrals, higher caseloads, among other statutory workloads, which is our implementation of the Minnesota African American Family Preservation and Child Welfare Disproportionality Act, and also the change in delinquency, I think, is something that we're watching pretty closely to see where our caseloads are going to be going from that. And then an increased racial disparities in deep end system involvement and loss of some of our prevention culture and capacity. So these are some like high level projections with kind of the services we've been provided, where our caseloads were prior to PASS and PATH, and where that would likely go if these programs were eliminated. And then fiscal picture. So if these programs are eliminated, what our costs would look like if we had to increase our staffing internally through county systems, which for 2027 would be around $600,000. And then our projections, if we continue these programs based on what we know of our costs currently, and then the RFP that was released and what those estimates are coming in. So for 2027 would be between $300,000 and $400,000. So our options are really, option A is to eliminate PASS and PATH, which would require us to hire 3.5 full-time employees. It would be 1.5 in our child protection, child welfare for our younger kids, and then it would be a full-time truancy for our older kids starting in 2027. Or it's 2, I'm sorry.
So does part of the 2 we were removing from the budget then would have to stay in the budget and up that? Okay.
Option B, continue PASS and PATH and our county truancy, and then the cost less than $500,000. And then option C, which is our recommended option, would be to continue PASS and PATH and discontinue our county truancy position, which would be $500,000, and then reallocate our full-time employee that's currently assigned to truancy. Questions?
And how will, if we have just, you know, more truancy, statutory truancy cases next year, is that covered in the RFP? Or are we gonna, like, if we reallocate that position, we don't have anybody to deal with them, what happens if next year who does it?
I think our position would be through the RFP, can I share? Like, I think certainly Catalasso, the expectation would be that they would be handling our truancy program.
Okay, just wanted to make sure.
And those conversations have happened with the county attorney to sort of say, like, right, we have a statutory, in statute,
Yep.
we are responsible. The county attorney has said, as long as we have a response, that can be a contract. And so we could say, like, our response is gonna be our contracted providers. We couldn't eliminate PATH and eliminate truancy and have
Right.
no response.
And so then if there's a truancy case that does end up going to the court system, the Catalasso group would be it would be county attorney and the Catalasso group working with that family? It would never, I mean, we're still gonna have some cases that have to go to county attorney's office, right?
So we've had a lot of discussions with our county attorney's office, and I think they are pretty aligned with, it doesn't work.
That we're just
we're not
never
looking
gonna
at filing
have cases.
I think it would depend on what else we're finding out about a family. Are there other things in a family that would look at, like, are we gonna file a petition for child
Sure.
safety? But school attendance alone, our county attorney's office has been pretty aligned, it
Okay.
doesn't work.
So it would probably elevate to a level of child protection anyways and be part of the
In
system.
a
So
different area,
I'm just
yes.
trying to understand, so we
Yeah.
won't have any,
We didn't have any this year,
okay,
so,
perfect.
yes.
That's great, I think.
But I mean, that, if there is some need, the county attorney is supportive of the program and he is working. That's what we heard him say at Scott
Yes.
Delivers that day. So if there was some attorney need, they're a partner in this and they're working with us.
Correct, and we've consulted with them a few times this year about even families that are in our Treehouse or Catalasso program. And it's really been, is there other things other than just attendance
Yeah.
and considering age
Right.
of kids and some of those things.
Okay, great.
Yeah.
I love that. What, and I'm sure it's all part of the RFP now, but, you know, the services Treehouse offered obviously had some decent outcomes. And we kind of looking at that being filled with the RFP and not, I mean, continuing to have some options for those kids, those older kids?
Yes, the RFP would still consider both aspects, the prevention and then the kids that are really struggling more long-term in the case management aspect.
Okay.
So it would include both of those.
Hey, when did that go south, or whatever the right word is? I guess technically south to New Prague. Treehouse, that is.
We had some discussions with Treehouse the beginning of the school year, probably late fall, around some practice. I think some of it was really about what Treehouse was able to pay, and that really, I think they struggled with keeping staff, and so that staff turnover was really impacted, I think, their ability to provide the service, and so I think that was a little bit where things kind of went south.
And I think the other piece, Commissioner Beer, is I think over time, Deb Bodensteiner, as the sort of local chapter director, was trying to identify sort of that role of direct service versus the support service to teens. And I think over time, the challenges of hiring, maintaining staff, and sort of that philosophy, she really has shifted to, they want to be in more of a, for lack of a better word, sort of consultant role. Like, how do you coach schools to respond versus actually be the responder?
Yeah, and I think additionally, she struggled a little bit with, like Commissioner Brecky, you made the point last week about the voluntary services, and that has been, I think, a lot of work we've done with some of our community providers on what a voluntary service is, or maybe should be. And so we can offer a lot of things to families, but sometimes we maybe need a little bit stronger offer to families, and I think that was that was something that Treehouse hadn't done before, and I think they were really wanting to work more voluntarily with families. And this isn't always that kind of service.
And so that slice demographic, whatever you want to call it, you're saying that part would go out for RFP because it felt like, which I know sometimes we're feeling in the wind, but felt like that had a good way of potentially doing some diversion, prevention type stuff, which is what we're all about. Is that a fair assessment? Since it's a feeling and anecdotal?
No, I think you're right, Commissioner Beer. So the RFP was released several months ago, and it includes really, we offered sort of what we are doing currently through PATH, and frankly PATH, from a prevention and a diversion lens, and so the respondents certainly addressed both of those pieces. So we would see trying to uphold the continued sort of model of how do we reach kids early, and how do we respond if they meet the statutory threshold.
I think, and that was really the spirit, I think, of the Scott County Delivers, and bringing this back today too, is that if we all feel that this prevention work is worthwhile and perhaps really playing into our ability to even pull back on our staffing as MAFA rolls out, then we would want to bring forward the RBA that would allow this work to continue. But if the board wants to move in that direction, then we're happy to bring that forward.
Yeah, the recommendation, Commissioner Beer, would be to bring that proposal forward for board authorization in July. And that way we're up and ready to rock and roll going into the school year in September, and we don't get behind the 8 ball again.
Thank you.
So do we see support for that? I think it's our prevention. I think it's actually showing a benefit from an outcome and a budget standpoint that we should continue to move it forward.
Okay.
All right.
Where do you want to reallocate the staff? The one
One
staff position?
person, yeah, we could do it there.
Yeah, I think for 2027, we would look at her remaining in our children's services area for the changes in our age of delinquency response.
We are eliminating 2 child protection workers that we showed you in the draft budget last week. So,
With the change of, I just want to, would that be the full role of the person, the change in the age of delinquency?
So I think it would be a combination. We also have some overflow in our PSOP programs, our Parent Support Outreach program. We, I think, have allocated a 1.5 or 1.25 staff, so she would be a part of that overflow. And then we would also look at our child welfare work now, the prevention work we're doing with families that have not mandated responses, but that we're doing voluntary outreach. She would have a role in that as well. That we also have some needs in our children's mental health area with some medical leaves that she would probably be looked at to do some overcome in that area.
I think it gives us some additional flexibility. So we've got some statute changes that are likely to increase workloads, and we know just really frankly across the division there are pressure points, and so it gives us some opportunity to say where are the greatest pressure points, and we're still trying to figure out what this age of delinquency is going to mean. Is that going to mean 12 cases or 57 cases? We don't really know. And so until we sort of get that up and operational, it gives us the flexibility to make sure we can meet the statutory need, as well as then look across the division and say where are the highest pressure points or pain points.
No, I like it. I just want to understand that, and I'm assuming we'll really track the change in age of delinquency and the impact on us. And like if I were you, I'd be like, I'm cutting these 2 child protection workers. I need a little bit of give in case we have, because we don't get to predict or schedule.
We also have one additional one that we right now have on hold, and as we go through the budget process, we're trying to decide like what's going to happen there. So you're right, like we've really cut back staffing, and this is an opportunity for us, we think, to hopefully keep supporting the trend that we're seeing, which we feel has been positive from a child welfare standpoint.
I mean, this is a huge success. So I mean, every time we talk about this, I feel like we got to give you guys a ton of credit. Like this is exactly what we've been saying we want to happen. So right?
Well, the age of delinquency, if I walked away from this morning, it is really a policy discussion at the legislature, right? How you're gonna handle some of this versus even, we're still dealing with the kids, just in a different area probably, but what is the policy now for dealing with the person that's caused the issue versus being a victim of an issue, correct?
Takes away a resource. I mean,
Yeah.
for the ones who are in the worst shape and there's no backfill resources.
From a policy standpoint, what do you do, right? I mean, that's what I walked away from in all these discussions.
Right.
It's not even
Yeah, I think
funding
Susan's right, like,
requests.
does this mean that we have like one more child we work with, or like 200 more?
Right.
Like we
Not too
we don't
bad,
know.
but-
Right.
And impact to certainly our community and community partners, right? Like what's the impact for law enforcement if you've got a young person at the age of 12 that's committed a serious offense, and at 2 a.m., like what's our response going to be? And I don't know that we have good solutions at this point. I think some of the work Nikki's doing currently that I think even from MAXA has some interest is how do we build out sort of a tiered level of response? So it's sort of those lower level things like curfew or vaping maybe is some resource, like here are some resources. But again, when you get to the deeper end of a response need, the question is what? And we don't have those answers yet.
All right, school-linked mental health, an update on this program and the outcomes we're seeing.
Sure. Thanks for having us today. I have to figure out how to work the clicker. So we're going to talk about the mental health center, give you an overview, an update, but then also talk about more specifically what we do in the schools and how that relates to our fiscal projections and what we'll be asking.
Yeah, and that's why we asked Dr. Ward to come, because there are some impacts from the CCBHC and how this works through our whole system of billings and where do we want to go.
Yeah, we had to change up our billing, and which we're gonna have to change up our contracts, which you all approve, which we're gonna have to bring in July. So we want to explain the why on that.
So as an overview, this is currently kind of our makeup of the mental health center. These are all the services that we do that are within the mental health center. Now, what's interesting about this, and actually there's a discussion happening right now about some legislative updates, is within this model, there are 5 different certifications, licenses, enrollments that we keep track of. Some are 2 years, some are 3 years, some pop up when revalidation happens at the state level. And actually there's a seminar or a webinar happening right now that's discussing that in 2028, the Minnesota Association for Community Mental Health, on behalf of CCBHCs, are trying to get the certifications down to 1. So if you're certified as a CCBHC, you won't have to do 5 different ones. The substance use disorder certification may still be an outlier, something we have to keep an eye on. So within our addition of the CCBHC, it added some administrative lift, as well as excellent opportunities for services for our clients. But I just wanted to kind of point that out, that these are all the things we do within the mental health center.
So Dr. Ward, when it's case management then, is that our adult mental health and our children's mental health? Is that where this is coming out of, or is that different case management?
That is different. So we still have children and adult within social services, but as part of the CCBHC, we are required to provide case management. So we have 1 adult and 1 child case manager within the CCBHC, and that's part of that integrated model that we'll get to in a couple of slides.
But it is different programming, so when they see case management here, those are still residing in different areas outside of the mental health center.
Yeah, we shifted existing staff, so it's still like a dotted line approach to that work, and it's something we had to include within this, but fiscally it made sense to keep their existing teams intact with the old structure.
So Scott County operates social service delivered case management, which most counties either do internally or contract out, and then we also have a clinic, which is our mental health center, that does case management. So where are we? You know that we have our clinic on the garden level over in the west building. But we're also in all these places in the community. When we do interviews, this is one of the fun things we like to talk about, where they ask us, what do we do? And we say, we're everywhere. So these are all the places where we provide mental health services. Well, the slide's a bit small. So we wanted to paint a picture for, you've seen this before, this is the mental health continuum. And we wanted to show you, as we start out on the left, those are the more preventative, early intervention and intervention services. That's what we would consider outpatient, so typically one time a week. Go to your therapist one time a week, or you have a diagnostic assessment, those pieces. As we move to the right, that's where services become more intensive and more expensive. And so we gave some ballpark figures about kind of, this will set the stage for what we're going to talk about in a couple more slides about how much each one of these services cost. And when we look at what pays for them, so on the left side, we receive, as a mental health center, we receive our CCBHC rate, which is currently $421 per service, and that's paid by insurance, also our grants and our contracts. Again, we will explain that more in a couple slides. But as we move to the right, that's when services become mandated, and that's when you look at more of our social service impact. So, for example, a stay at the JAP for a kiddo is $541 per day. And then we had a kiddo over in Nikki's area who needed to go to residential treatment, and the cost for that is about $15,000 per month, and those are paid by levy. So this is showing that if we can, meet with a kid upstream and get a service delivered, possibly get it paid by insurance, a grant, or a contract, we're actually saving money for that kiddo that might end up in a higher level of care.
So, here, Dr. Ward, isn't some of this also paid by the county when we're talking about uncompensated care? Even in the one where it says third party, aren't we the third party in some of those situations?
Some parts, it's a pretty small amount when you're talking about kids, because we do have our grant and we do have our contracts.
Gotcha.
But for adults, yes, there's not as many funding streams for the adults. And you'll see that as we look at the services that take place at our clinic, that's where our adults are, because our adults are not in school or day treatment or some of these other places that we're talking about. And given the fact that we do work with pretty significant, we would consider them SPMI, significant persistent mentally ill. Those are the people who have high levels of depression, schizophrenia. Those are the people who typically have higher no-show rates. That does add to a levy cost.
Do you have any, and it's probably anecdotal, but I would assume here compared to other similar places in the state, we have a higher private pay insurance rate than others, do we not?
So that's on a slide coming up. We're about a 45-55% split, 45% Medicaid, 55 commercial.
Great. And that's, other, is that standard, is that?
I think, when I look at maybe one data point that correlates to that is the percentage of people that are on medical assistance. And about 1 in 5 people in Scott County are on medical assistance or qualify for medical assistance, and that's just slightly better than the state, which is probably like 1 in 4. So
okay.
We're right in the same ballpark as everybody else.
Okay, thank you.
So shifting gears to the kind of the meat of what we're going to talk to you about, our services in the school. We call our programming in the school the Connect program. It's a term that we came up with. It's something that social workers at schools, counselors can reference. What's important about that is it really is the same services we do, therapy, diagnostic assessment, same things we do in the clinic, we just do them in the school. There is a piece about consultation with the schools that I think is maybe an added layer to those pieces, but we've been operating this program for many years. We have therapists in most of the schools in Scott County. These are our school districts, our partners that we work with. This program has a lot of state support, as you all know. It's written into statute. The grant's written into statute. It's become kind of, I think when we were doing it years ago, it was more an outlier, it's become, I think, more of a norm now in terms of mental health delivery.
In many years, it's been 20 years?
Probably, yeah, probably.
That'd be my guess. I just think, just to give some context.
20 years we've been in the schools?
I think so.
Could be, I know for
I'm
sure
wondering.
it's been, I know for sure it's been 15. I've been here.
I was gonna say, wasn't this one of the things that came out of the Great Recession? I mean, 20 seems a long time. That'd be 2006? I thought it was more like 2010, 12? Maybe
I
not?
know that there was an expansion of Shakopee in 2013.
Yeah.
And I know that there was a partnership prior to that, so.
Was
I
that
think-
with the Reflections program though? We've always, haven't we quite often been there? I mean, we've been there a long
Yep,
time.
been there a long time, yeah.
Our first contract with the school was Belle Plaine, and that was Troy Johnson, who actually retired last year. And that was before the grant, and the state had this, philosophy of doing school linked mental health. Dr. Raditz, and I'll explain again, like, she thought it would be a great way to access kids, and you guys know her, she's pretty innovative in her thought process, and she was part of when the state then decided to start an initiative and come up with funds for a grant. She was part of that work group because she had already been administering and overseeing services in the school.
So it started in Belle Plaine before the state even got involved.
2007, the grant program from the state started. So yeah, I was thinking about my kids being in school.
Yeah.
Yeah, I think a lot of this got going after Sandy Hook happened, so.
So you've seen this
Hey,
before.
quick question, if I could, with the funding. I mean, I heard you say statute, which is great. I was just curious, with schools, everyone getting squeezed, is there a better than average concern that this could be something that's on the block at some point if referendums don't pass, or any other financial reason where schools may have to kick this, in your opinion?
Yeah, I mean, we've seen some fluctuation, like, we have a slide in a little bit where you'll see that our, like, Savage area schools decreased by 1 FTE, but another school district then picked that up. So we do have an out in the contract that, we can always make those adjustments if that is needed, and we can continue to keep that in place. Because we are in a really unique position that we not only have the funding that we get from insurance, but then we also have the school contract and then the contracts with our school districts. So we really try to make this as levy neutral for us as we can. So, but we've got a couple slides that will illustrate that.
So that's.
Okay,
that's what-
so hold that question, because that was my clarity. Is it levy neutral? Is just for clarity?
Yep, we got one of those.
I'll wait.
That's why we're here, Commissioner Beer. It's not a mandated service. It's grant funded from the state or insurance, and the school districts have a choice whether they want to do the match.
Yep.
So these are the services we provide in the schools. The student services, like, I kind of put them in 2 buckets. Student services are things that we do with the family, the child, the teacher. We also do engagement with the professionals in the schools, and I think as we heard Nikki and Suzanne talk about earlier, that's really important, because if we can work as a team, and if a child can hear the same language as they're hearing in therapy, as they're hearing in the classroom, that moves mountains for the child. If they can grasp on better, and then that success just compounds when they do well in a school. They feel more confident, and we're going to see more effective change. I mean, I could speak about this for a long time, but I think that's kind of the point of the schooling piece. So, why schools? School days account for 50% of a child's year. So again, when you think about how to access children, it's a great place to find them, identify them. When we also think about schools and think about how many adults interact with a kid, that's more opportunities for an adult to notice that something might be happening with a child and refer them for services. So it's a great referral, it's a great prevention, it's great for early identification. I think for a family, it's really great. It decreases parents' time where they have to pick up a kid, take off work, drive to the appointment, drive the kid back to school. It also helps with the kid and missed time. You know, we want kids to get service, but if they have to drive to a clinic, that for sure at least doubles the time that they're going to miss from school for their appointment. We also know that this helps with integration and collaboration with school staff. So for our kids who are involved in maybe higher services like IEPs, it helps keep those kids in the lowest level of like a level 3 versus having to go to a level 4, and that actually changes them, that changes their school. So the more we can keep kids in their home district, we know kids are more successful. And then I think the most important piece is that untreated mental illness and symptoms impact the child's ability to learn, and that's their job, to learn. So this is a high-level slide about the revenue sources. So in terms of our funding for our school-linked therapists, we have four primary revenue sources. We bill insurance, and we work really hard to help parents get on insurance. Again, that's a part of the CCBHC, and care coordination is helping parents and families receive and get on insurance. Our Medicaid clients services are reimbursed at the CCBHC rates. Private insurance is reimbursed at varied rates. It all just depends on what we get contracted with when we talk to our commercial payers. For any service that isn't funded by insurance, we have it funded by our DHS grant. And again, we'll speak about kind of how that, now that we're CCBHC, how we'll be doing that differently. This grant's been available, yes, since 2007, and it is now in statute. And then we have school contributions. So all the schools have contracts with us where they pay for a portion of the uncompensated time and cost to deliver the service. And that's what we're going to be talking about, is how we need to change how we look at that, but still remaining no impact to the levy. So switching to the CCBHC cost reimbursement methodology, you've seen this. This is our bowl of soup. So with the CCBHC, we can put in all of our costs that it costs us to do the delivery of service. So you've probably heard of us talk about the cost report. It's something that we worked on for the past 8 weeks. So Steve was very helpful. Thank you for all your help with the cost report. Because we're able to put in all the things that it costs us to operate the clinic. So everything from, of course, salary, benefits, but we also can put in, Steve would know more, like facility costs, insurance costs, electricity costs, cell phone costs, some of those other allocations that show up in our budget reports, we're able to then put on that. And it's this big spreadsheet that then spits out a rate that tells us how much we get to charge per service for Medicaid insurance. So why this is important in the bowl of soup for the required services is on the left-hand side, these are the clinical services that at CCBHC we are required to do. These are things that we can bill to insurance. So you do a hit of case management, that's a bill to insurance. The things on the right-hand side, those are things that we're required to do as a CCBHC, but those are not billable services. So when you think about the construct of like, why you get to put all those costs into each service you deliver, it's to offset and to pay for the things on the right-hand side that you don't have a fundable like mechanism for, because you need to deliver these services for everybody, regardless if they have Medicaid, private insurance, or no insurance. Every client who comes to the CCBHC gets the same level of service. All right, so this is a high-level look at where we started with revenue and how the CCBHC has impacted where we have gone. So in 2023, this was before we were a CCBHC, you can see our insurance revenue was about $1.7 million. On average, we received $107 per therapy session at the Medicaid rate. And then in 2024, we were certified as a CCBHC in October. You can see that our insurance revenue increased by 38.3%, and that was for 1 quarter is when we were certified. In 2025, that was our first full year as operational as a CCBHC. We did do more services because we increased our service line, our array with arms, pier, those pieces. But the revenue went up to $4.3 million. That's 150% increase from 2023. And on the third row down shows our rate per therapy session. So in 2024, that our rate was $403. Last year it was $411. This year it's $421. And that's that cost report that we were talking about that we now will do every year. For next year, we are expecting our 2027 rate to go down slightly. When we did our cost report in 2023, we were able to put in anticipated costs. Once you are certified as a CCBHC, you have to use actual costs. So for our rate for 27, we had to use 25's actuals.
So like, for example, what the difference is when we projected, we could project all of the staff to the mental health center and nobody leaving. Like we could project that we have every employee there for 12 months. And then we were actually able to project anticipated costs with their salary increases. When you look at actuals, we of course had turnover. We had a staffing freeze at the end of last year as we moved to Workday. So that impacts your total costs available. So it'll go up again then as we rebase again in 2 years. So.
So for the 2026 budget, this is what it looks like when we look at our services that we do in the clinic, at our school, and day treatment. So school is that Connect program, that's what we've been talking about. Day treatment, we do that in partnership with Southwest Metro. We have 2 sites, and that's for kiddos that are like 2nd grade up and through high school. Day treatment is a fairly intensive service. Kids get therapy every day. So when you think about that billable hit, that's why the revenue is more when you look at how many kids we serve and how many FTEs we have in there. It's because those kids get they get about 12 hours of therapy a week. And they're there for about 6 to 9 months, and then the goal is to get them back to their home district.
So the 2026 revenue from the schools, that's included in the revenue?
Mm-hmm.
And, okay.
And a grant.
Yeah, and so the expenses include everything. This is salary, this is benefits, this is our cost for a psychiatrist, this is some of my time, some of all your time, this is all of the overhead, lights, everything is included in this. And so this is one of the primary reasons why Dr. Raditz looked at setting up school contracts, is because in the clinic, we often will have no-shows, or you don't have consistent people that will follow through, like life comes up. In the schools, we have, if there's a child that's sick that day, the therapist can grab another kid during a passing period and bring them in, and they could potentially do a catch-up or a make-up therapy. So the ability to bill is more predictable and more available. So that's the business side, but then that's good. That's just good for the child that's there. And for any of the kids that are involved in our child protection or child mental health, also why Dr. Raditz went this direction, they're actually in school. We want them in school. And so we're actually seeing those kids also in school. So sometimes when we think clinic, we think maybe just serving our Scott County programs, and it's not true. Like, we're also doing that within the day treatment and also the school programming. We're serving those kids that are involved in our other programming and social services.
So this past year, we met with some experts for CCBHC billing, and we received some excellent guidance and some clarity about how we need to do our contracts and our grant billing. So we do need to switch up how we've been doing our contracts with our schools. So as a CCBHC, for any funding that you receive, whether it's insurance, contracts, or grants, it has to be done per clinical service. because that's the whole model of a CCBHC, is what is the cost to do that one service with that one client? The goal is to get your costs covered. So as you have all these different revenue sources, you can, if your cost is like ours, $421 this year, we're able to then take portions of funding to make up that whole bowl of soup, right, that ladle of soup of $421 to pay for that cost of service. So for our contracts, we'll be switching to that methodology where the schools will be paying for every service that we do up to a point of making us whole, paying that $421 per cost of service. And we'll go through that in more detail.
And if the board remembers, I think Pam was here when we started the CCBHC conversation. It was for that reason, right? It was to be able to recoup. It's one of the few programs where we recover the true cost of doing the entire business and where it has all been calculated out. And that's why this number becomes important as we talk through it now.
And it's just a different, way of looking at this, because what we had historically done with the school districts is we would pay for a time where a therapist isn't with a student. And so it would be like $58 an hour if they're like on vacation, here at a meeting, like times that we can't bill for. So it's a different contract structure. So we're gonna have to, so we'll be billing now for that uncompensated or undercompensated time with a student at the 400 and whatever our CCBHC rate is. And that's, we have Steve here to say, like, that's what the CPA told us, that this is how we have to bill. Like, we actually don't really have a choice in the matter.
Correct. If you're going to include the costs of the services provided by the staff working there, we have to include the revenue or the billing at those rates. Otherwise, you have to completely exclude it on both sides. So.
Right.
And so part of this discussion is also, if we look at what would be charging schools to do this at that rate on the per service, the schools would probably stop doing this service because it would be expensive. So under this though, we tried to structure a way of saying we can fully cover the cost of the service, but it may look a little different with how we're billing that hourly rate. And so structuring our contracts and structuring how we view it a little bit differently.
Have the schools seen a change in how much they're contributing? I mean, especially last year, like a decrease because of the billing and CCBHC?
Because of the way we were doing it, where they were paying for the time that a staff did not receive any, was not doing a clinical service, it was really more dependent on how busy the staff was. So we've increased our rates. You know, we were at $52 an hour 5 years ago, and now we're at $58. So they have seen an increase. We're hoping with this model, it actually will have a not to exceed for them. And I think from a budget standpoint, that will actually help them. Because for us, it's really difficult to predict what their bill is going to be because it's all dependent on how busy the therapist is, which is all dependent on how many referrals the school gets us. So now I think we'll have a more level and predictable way of billing the schools. But we have a slide coming up where you'll see the changes and what they've paid.
And has there been any, you know, I think especially of Prior Lake Savage right now and their challenges, any indications from districts that they're going to be out?
I mean, I think that's always something to consider. I think it's interesting. You'll see, you know, Prior Lake Savage, and you'll see, well, maybe turn to that slide. I think it's next. You know, Savage, Shakopee has always contracted for additional FTEs. As you can see, they have 7 staff that they have requested that they partner with and pay the additional amount. Prior Lake Savage went from 2 to 1. You know, we've seen a few things like, you know, like calls in different areas. You know, is that related to their decrease and not having enough support here? If you speak to, like, I know we had the special ed director that was a part of the truancy RFP process, and other administrators would say that, you know, having less resources has made jobs for those school administrators more difficult. And then, you know, does that bring an inflow into county services in another way, like through child protection, through crisis calls? perhaps it might, right?
Do we-
And so I think that's something that we will probably be keeping an eye on, because when you've got, like, Shakapee's pretty resourced for this, and that's helpful to us, I think that's helpful to them as well.
Do we track, so like if we get calls from Linden, Prior Lake, Spring Lake, or I mean Prior Lake Savage, so they dropped in just,
In the 2020, last fall, the last school year.
so
Yes.
have we tracked, have we gotten any more calls either from families or kids in that area going around the school or from the school itself that they need more supports?
The mobile crisis has, their middle schools and Bridges has, I think there's been an increase within the crisis calls that they've had. I think New Prague also has had an increase within the mobile crisis numbers. And then I think we saw, you guys had the last Scott County Delivery showed an increase in the amount accessing truancy. Just 1 year. I think, that it's something that I think we're going to want to continue to keep an eye on and see if there's continued inflow.
I mean, the population of those schools isn't that different in size.
It's not.
They are both about the same size high school.
Yep. Yep, it's true. So,
But the ones who have one, they tend to have it at the high school, and then like a Shakopee, they have folks at their middle school, they have spread all over.
they do, yeah.
That was one thing I wrote down, like, I think when we think about just our prevention work bucket, we probably should be elevating this a little more,
Keeping track.
Yeah, because this is,
Right.
and that was your question, making sure that, especially when the cost to levy is as low as it is, and it could be alleviating a lot of other costs.
True. That's a good point. Yeah.
So this is a lot of numbers, a lot of data. I think what we're asking from the board here is our not to exceed number for 2027. When we projected out the math, again, I have lots of spreadsheets that to crunch these numbers to get to this. We want to cover our costs. We want to be fair to our districts. We also don't want to, present with sticker shock. So as we look at, if a therapist stays, does what they did in terms of number of services, we have a lot of historical data to be able to look at how many services do they do in the school. When we looked at that and we looked at, okay, if we received, the 400, I think we did it, $403, I estimated. If we do it at that rate, what do we need to charge our schools to cover our costs? And that is the number that we have at the not to exceeds. We did make that a little higher because, we want to, have some cushion there because we're not sure, you can't predict the future 100%. But our not to exceeds for each of the districts is on the right-hand side, and we think that's important to look at what they've paid historically. So as a partner with the schools, we also don't want to present them with a tremendously high figure. So you'll see that they match. I mean, they're a little higher than what their highest payment has been over the years, but it's concurrent with where their requested FTE is, because that's also changed. So you can't always compare one year to another because there's different, Belle Plaine went up one, Prior Lake went down one, Shakopee's grown, those pieces.
In day treatment, that's Southwest Metro, they have a state grant that they received in 2018. We actually received it, which is why there isn't a dollar amount there, but they actually received the grant now, and that's what they pay us from. So we tend to budget like around $650,000 in our budget on the school contracts. So, but we wanted to leave this as kind of a starting point and let you all know that we've got to change our methodology.
And this is based on like the $53 an hour to the $58 an hour, right? When you're taking a look at this?
That's 2018 to
Right.
2025,
Yeah, this
how
is
we
like-
historically built.
Yep. And we can bring it back next year and let you know if this prediction worked out.
Yeah.
So, yep.
So we're going to, how does that work with the CC? So just so it's clear, the 421 is not what we're showing when we build the schools, or we are and it's gonna eat it up. I just want everybody clear on this.
Yeah, so how I would see this, you can correct me if I'm wrong here, but if we have a child that's on medical assistance, we're still just billing medical assistance and we'll collect through insurance. If we have a child who is on private pay and we collect $100 from that, we can actually, we can bill the grant, 321, or we could bill the school district. So we're gonna like buy down this, the grant first.
Yep.
And then anything remaining would be to the school district, so.
And hopefully it's not going above the caps that we are trying to really work through here, correct?
Right, and if we can get it all covered between insurance and the grant, then you get the school district, but they're last payer.
We did these predictions based on if we had done this methodology last year.
Yeah,
It's really
Tanya's,
the best way we can, estimate, we're
And
gonna be watching this quarter by quarter.
And if it's not covered, then we bill social service and the levy a program for that cost? Is that what the goal would be then, or is that what you're talking about?
That would be my goal, is to have basically say the county is covering this cost, and even if it's not, so that would be consistent with the CCBHC methodology of fully covering their costs.
So if you go back a slide to where it showed levy and program cost, that $47,000 then would show a bill to Scott County for this program, because that would have covered the amount of money then. Am I following it, so the board understands
That's the
what we're
goal that
doing?
we're trying to get at, is this is we want the schools to do this because we know it's cheaper to be up front than those deeper end services the further we go. We're covering the cost that we've already built in under this model, but as we try and work towards this more kind of enterprise model for mental health center and the CCBHC, showing it as a contribution from the county for this kind of care. It doesn't functionally change our levy impact on this, but it changes how we're just moving the dollars around to be a little bit more consistent with that enterprise functionality.
And it will actually show up then as the enterprise payment
That's
from the
yeah.
county, right? It just would be a payment into it. It'll be more transparent and clear.
I just, I know we can pick on this program about other programs that aren't funded, but I do like how we leverage, like the schools have to be true partners here. They have a true buy-in and partnership. What does our 2027 budget look like on those levy numbers? Pretty similar?
we are in the process of doing the 2027 budget right now, so, yeah.
Initially, looks pretty
It'll be
similar.
higher. I think it'll be higher, some higher on the levy, right?
Yeah, I always hate to say yes, because I always want to try to see, so just trying to, everything we can do to not have that happen, so.
Right, but I mean,
but we know we
it's
have stretched
realistic
salaries.
that 47 could be a few $1,000s more.
Yeah.
Could be under if you can bill all your insurance.
Right,
But I mean,
right.
we've seen it go up, right, if you look at it historically. So to think it wouldn't go up a few $1,000s or something, I think.
But did it go down with the CCBHC? Like historically, we saw it go up, and then we saw it go down.
It did, I mean,
We're not the school number.
we're getting better at billing on some of this. I think the challenge is going to be that our CCBHC rate will go from like probably 421 to 400 next year. And then we predict that that's going to continue. They do an annual adjustment, so it'll go up again in 2028, and then we'll do a readjustment for 2029, and I would expect that to go up actually pretty significantly. When we met with them, they had said typically they allow you to run the service for 2 years. Minnesota didn't do that this time. They only let us run it for a year before they're making us rebase. He said because of that, the rate goes down, but then it will go up thereafter. And no matter what, like $400 per service is way better than the 100 or 107 we were getting.
He said most clinics experience a 15% decrease in their rate after their first one, and ours is not, so I think it's pretty good about that. We'll see.
And he did say it's very consistent that this occurs, and that's why they had done pilot projects of CCBHCs, and during the pilot projects, they didn't recost everything after the first year. But yes, as has been stated, it is expected that the rate will go back to what it was and higher in the future.
So this is coming at the next board meeting already?
It'll come in July
Or in
or
July.
sometime. Yeah, because we'll have to run this conversation through our school district.
Right, that's what I was just gonna say.
Yeah.
Obviously, it's not gonna come to us until you've already talked.
Yep.
All right, anything else? Do you have any more slides? Are you good, Dr.?
Oh, no, I'm good. I'm doing the last one that I'm real proud of.
Hey, I just want to say I appreciate how the numbers seem to include everything. I think, Barb, you mentioned that these numbers are inclusive of every bit of overhead. And so I think that's important. And I know we're trying to be better and better at that moving forward. So it's not say fake numbers, but it's inclusive of everything it costs to run this program. So thank you for that.
Well, and I just appreciate that with this, that we actually get they call it an MEI adjustment annually, like nowhere else in any of our other programs, at least in Health and Human Services, are we getting an annual increase.
Right.
So I do feel like if we're going to do this type of work, doing it through this model is going to be the most cost effective.
And then also going back to my earlier questions, I mean, it feels like we're kind of running this with our guard up, knowing that things are subject to change, but, funding wise, but we also seem to believe, at least anecdotally, I know sometimes it's hard to measure things that actually count, but that this is paying dividends, both in human successes, and my granddaughter agrees, but also financially as well. Is that a fair assessment?
I might be one of the more biased people around the table on that question, so I would say yes. I think that we see positive results for both the students, and when we speak to our partners, talk to Ryan down in Belle Plaine, right? If there's one thing that he says that this county does better than any other county he's worked in, it's this program. So he sees it with the students, and then with the relationship that we've been able to build and partner with school districts.
I agree with that. When I talk to school administration, this is the one program they really recognize and appreciate, and I think it shows, otherwise they wouldn't put the money in.
Mm-hmm.
Yeah, thank you, Selena.
So we just have a short, just a discussion. I'm not even sure it's recommendations. This is just more some perspective. We've been discussing dispatch, so I asked Danny, Luke and I, and Jeff and Scott had an interesting meeting, I thought, with Prior Lake yesterday on dispatch. And so just going to give you some perspective here real quickly on that and what it would look like, and maybe the timing to even get there. And then just some historic perspective, because that seems to have been something, and it's just rough. These aren't finalized. We need to add more data to it moving forward and some other lines, but some of the historic 20-year perspective on some of these programs.
So yeah, let's do one through the agenda. What I would say with the historic data before jumping into fire dispatch is what we're looking at gives us a good guide to say where do we need to dig in further and look more, and when we're seeing drastic changes over that 20-year perspective. Where are we being funded? Where is being more asked of us? What's driving just overall increase in the budget? Start with fire dispatch staffing. So we have the continued request from the cities. I know you all have heard of it and probably more knowledgeable than I am. Demand really being driven by the full-time fire departments, and we are seeing a significant increased request for fire dispatching. Related to when they want to be called out, when we're choosing to call them out, all those sorts of things.
Yeah, if you go to the City of Savage on their website, fire dispatch is one of their priorities for their program. I think some of the things that they're pushing to be called even when it's an Alina to an Alina type thing that they've substantiated they want to go to, is several hundred calls. So each of these takes more time, right? A fire dispatch is more minutes than a police dispatch to our staff.
Well, just out of clarification here, Savage is sending fire to all medicals, so when we think of fire dispatch, we're not thinking just fires, we're thinking of all medicals.
Yes, so when we call it fire dispatcher, it's a position dedicated to dispatching fire departments when calls meet criteria. So it's not dedicated to dispatching for a fire that's going on, it's dispatching fire departments. And that's based on, you know, our 911 criteria is different. If it's a vehicle accident with an injury, we usually are sending the fire departments out with it. If it's unknown whether they're an injury, we would typically send out the fire departments with it. But if it's known, nope, everyone's out of the car, they look fine, we may not have in that circumstance, or a fender bender.
And Luke could maybe even speak to it better, but we had some of that criteria set, and that's been dramatically changed in the last 3 years on what we're dispatching them to, which then we used an estimate of like 8 to 8 if that's the busiest time. But maybe you want to talk about some of those changes.
Yeah, historically, each city kind of would give criteria to the dispatch center over the last 30 years. So some would go into different types of crashes, some wouldn't. We kept trying to push them to get consistent because the dispatchers literally have to look at a grid based on which city it is, decide is this a fire call or not. So coming out of COVID, we worked with, and Savage Fire led this, the chief at the time, setting high priority medical versus medical, high priority crash versus crash to kind of define it. So a high priority crash, maybe an ATV, a motorcycle, a head injury, you know, of course, obvious injuries, but things that would be known to probably cause an injury, and send fire to every one of those, but not send them to the unknown crashes or the, you know, it's a snowstorm and somebody spun out in the ditch, like there's no sign of any injury. Let's just send the officers and get there and determine if there's injuries. Medical, same thing. If it's CPR, if it's somebody falling off a roof, if it's stroke symptoms, all those like high priorities, send fire and police and ambulance. If it's not, if it's the lower level thing or a cut or a, you know, trip and fall type thing, just send police and ambulance, let them deal with it. So we had this defined out to make it really clear. We had everybody on board, which was making dispatching easier, and then the duty crews started coming, and then it turned into each city duty crew requesting, or not each, but Savage and Fire late, saying, well, now we just want to go to every medical with some conversation around, you know, paramedic response times and things like that, driving the need. But that's where the numbers come from. When you talk about the data of the fire response calls, all of a sudden you're seeing this huge increase in the last 3 years because it's not that there's more fires, it's not that there's more medicals happening, it's that the fire departments are choosing to go to in those cities to more of the calls that are already happening. So sometimes I think people get confused too that there's more medicals in the city of Heart Lake, and there's not. You know, it goes up 50 a year, but it's not, the need isn't growing, it's the policy decision to send the fire department to all those types of instances.
So when they look at the data, they're saying the large volume is really that 8 a.m. to 8 p.m. hours that we wanted to see staffing.
That was just a preliminary. We'd have to get the actual data, but this is just a preliminary look to give you a feel.
Would be a standard 911 telecommunicator filling this role. 12 hours a day, 365 days a year would be $43.80 for the hours that we need to cover. One FTE covers approximately 1,500 hours a year when you count for training, meetings, and absences during that time. So you do that math, and 3 FTE per day and an 8 p.m. shift 24/7. So when we cost, the average annual salary is about $75,000 a year. That is $25,000. Sheriff's office overhead. This was Danny's rough math, but look at the sheriff's admin and the number of positions in the sheriff's office, the supervisors for district. $1,000 in overhead cost to cover their portion of that for every fire dispatcher. The county cost allocation per FTE is about $17,769. So the total cost per FTE to add is about $153,884. Multiplied by 3, $461,000 for our 2026 cost estimate. So this is using an estimate from yesterday when I pulled it, the salaries and benefits and that sort of.
I asked him to put it in here today because we've talked to Prior Lake and we've talked to Savage. We still have not met with Shakopee and their administrator, mayor, like we have with the others. But we did meet with Prior Lake yesterday on it, and I think their feeling is it shouldn't be a city cost. That was pretty clear, that this should be something the county does. And we said, no, you should have been having these discussions as we requested like 5 years ago on when you add a new officer, when you make changes in your fire. There are impacts that you are causing in other parts of the system. And this has a dramatic impact on our staffing models and how we provide service. And so this was to give you a feel, because our staff right now is feeling the pain. There is a push from one city especially, that we have a full-time fire dispatcher. And if we were to do this, by the time it takes to give us the authority to hire and then to get that person on board and trained, we're probably looking at a year-long process. It wouldn't be till sometime, if you could start tomorrow, which we can't do because we haven't had discussions with the cities, we don't have agreements. But you still wouldn't have them on board and ready to go fully until probably a year from now. And so that is one of the issues with this. If we were going to try to do this and provide it, we need to be having those discussions, what it would look like for each city. Would you charge them per call? Do you charge them by population? I mean, there's different ways of doing this that it would take, but we're looking at somewhere about a $500,000 increase in 2027 to be able to fund these dispatchers.
Just a couple questions that I could see cities asking, more so, but I think we need to be prepared. So let's say we do this, what relief is provided in the current system because we have the designated fire dispatch from 8 to 8? They're gonna say, well, it's not like this person's just taking new calls. Is it at a half FTE? Is it like, that's what I'd say if I was in that chair saying, well, what's the relief?
So the crunch is the person that's currently dispatching fire departments is also answering 911 calls.
Right.
So what's happened is we went from, it's 1,000 calls in '98 to 3,000 calls 12 years ago, 10 years ago. Now it's 9,000 calls. So that bandwidth of that person is now they're managing the fire calls and the 911 calls are ringing in because there's a dedicated 911 phone person. They're the second person. So when 2 calls are coming in, that's the person answering. It's just this crunch and that's causing their turnover. It's just the pressure.
So this is just right sizing.
Yep, right sizing. And our staffing study from 2 years ago speaks to this need, and it shows the call volumes and stuff.
I'm just trying to get the language to talk about. And then a city's gonna say, what? Sheriff's office overhead on top of county cost allocation? Is that overhead really realistic for each dispatcher? Is that overhead, like other parts of the sheriff's office have more overhead than dispatch? Well, how do you speak to that?
It's distributed by a head count.
Right, but I mean, like,
I would say honestly, in the terms of the overhead, the training, this is probably a more realistic overhead than even some areas. We don't have a lot of turnover in patrol or our support services area. We have quite a bit of training in dispatch, a decent amount of turnover, then it's been better. Jail still has probably the highest turnover, but that's also the biggest portion of overhead.
Okay, good.
The other thing I would say, Commissioner, too, what are they gonna see out of this cost? Is when we come up every once in a while on the dispatch's performance measures, it's that fire dispatch one that we're not meeting the targets.
Right.
And so they want that target faster, this is how we have to do it. That's where the biggest metric you're gonna see is impacted outside of the financial cost.
And the request isn't new. I was hearing in 2016, like you should have a dedicated fire dispatcher. They should be somebody that's always ready to answer us. When we ask a question on the radio, there should be somebody there, not a pause because they're on the phone or whatever. So it's not a new request.
Right.
And they do speak about if they have a Mayday or emergency, like, well, there should be always a dispatcher just ready to, speak to us. And we can't promise that now because maybe.
But sometimes the people who bring that up aren't the people who make the fiscal decisions either.
Yep. So
I don't think we should say, you guys asked, until the right people asked. And then I assume we're gonna talk about, like, what puts us over the edge if, like, 3 of our cities say, no, we're not sending fire to every medical, we don't need this, we think we're doing fine, we're not asking for more service?
They don't, the only
Right,
three
that's
that
what I
do
mean.
are this is really intended to build the larger 3 cities based on programmatic changes and decisions they've made with not including these costs in those decisions.
And so it would need to be very clear to the other cities that if they make that kind of decision, that would, so I think those criteria have to be very well, and it's not that hard to fire to go to all medicals. Right?
And we're still covering it from 8 to 8, right? It's not like there isn't a fire call between 8 at night and 8 in the morning. Oh, we'll put you on hold till, I mean, we're still covering those through our normal dispatching.
And so if we go forward with this to those 3 big cities, you know, if they say no, their options are they could do dispatch somewhere else.
Sure, they could go to Dakota.
They could change their criteria. Is that what we're saying? I mean, because I think we just have to be upfront. This is what we need to be able to continue to offer this service. If you don't like it, what are your options? I mean, I feel like we gotta be really clear. We're not holding you hostage. You could change your protocol. You could
They
go
can change
somewhere
the
else.
protocol, but it's also gonna be slower dispatch for fire. When it's not a priority, they're gonna be lower on the chain for a non-emergency medical, and then they'll go somewhere else.
And we probably should be upfront to the townships because their costs from the cities are gonna go up a lot based on this too.
They're gonna be okay with it.
Yeah, I mean, Credit River, Spring Lake, Louisville, Jackson, whoever they're provided
Yep.
would be impacted by
I
it.
agree. A little bit.
Right now, just to dispatch and fire, they treat each one of these 3 cities different. They have to go through a notebook to try to figure out where and how they're dispatching when you listen to Scott talk through that process. Now, it should, going to the new system will help, so there's hopefully some relief there too that will make us more efficient, but it doesn't solve all of it.
So I feel like this isn't new. It's been socialized a bit. Is a next step really a meeting with those 3 cities? Like, are you gonna change your protocol or you want us to do this? And we'll send you a bill?
I think that's why we're here, to talk through. We've heard the board say we support this. We should start to charge them if we have to go to additional. We believe part of the reason we have turnover and issues in that department is the stress of trying to handle all of this. And that we're at that point where, based on what we're hearing, we probably need to hire a couple fire dispatchers.
For counties, and I know I'm not asking you to give us the same thing that we've gotten every year. I should go back and find it, but for dispatch centers that are similar to ours, not Dakota, that's different because they're billing out everybody, that's joint powers. Have they done this? Because it's the same,
I think the one we saw the other day at District 10, Anoka charges back to their cities. That's the one you toured when you were up there.
And Carver doesn't?
Well, I don't know what Carver does for fire. I mean, they are for police, they're everybody except Shasta,
Right.
and I think they have some.
But I just
more
wonder
than-
if fire, they've probably seen some of the same things as they went to full-time.
I don't know what Carver does.
Do you know if the cities have full-time
I
there?
bet Chaska and Shane do now.
I don't know.
I just don't know.
Yeah, okay, just curious.
Anoka has, because we asked that question.
When I've talked with Scott about it, and I'm trying to recall back, like, every place has different models for it. It's not a consistent one. I think Dakota, at one point, it was like the number of clicks on the radio, and they were doing the charge, and so they're like, for God's sake, don't click your radio unless you absolutely need it, and some of those things that drive, which is just fudging the numbers, really. We've talked about it, is it a per radio one? If you want a radio, this is gonna be the charge for dispatch, when we look at that back and past and some other things too, so.
And then the radio ones, yeah, we used to backfill just the cost of the radio system, which is a whole other, expense. So yeah, that was the radio usage.
We don't charge them for that either.
And then the systems, the phone system, the logger, the
Yeah.
pieces, all the stuff like that, that isn't part of this conversation.
Which could be.
Yeah. Any more questions on dispatch?
What, I mean, have we given direction?
Waiting for it.
What's the direction? Fear?
Do it.
You know where I stand. I mean, this is something that we don't have a choice. It's as simple as that. And I just wish, I think this conversation started by saying, oh, these are conversations that we should have had 5 years ago. And I know what that meant. But the reality is we did try to have those conversations 3 to 4 to 5 years ago, and it felt like a one-way street. And here we are. So we don't have a choice.
I agree.
Okay, I agree.
Cool. Get the party started. All right, we'll sit down and put some meetings together.
All right,
I'll
so,
tell you next year.
Very funny.
This guy's full of them.
just to give a little bit of a primer, so, a few months ago now, Leslie went through and actually put together in a spreadsheet for us a 20-year budget and levy history of what was adopted by the board for each fiscal year. So it was the budget, levy. We also went through and pulled back from our annual comprehensive financial report, the revenue history for 20 years. So the goal was, what is the story that this is telling us? And so we wanted to bring some of that data forward. I think there's more work to be done, as Leslie said, especially as we get into, okay, what's the story here for this area? But it starts to give us a picture when you look at the percentage changes and what was the percentage change from budget versus percentage change from levy of where have there been cost shifts, where have we just seen programmatic cost increases. So this is a starting point for us to do some more work on this, but also interested in your feedback and what you find interesting or not interesting within here. So as we look at this is our historic budget by division. If you look back 2007 through 2026 is what we're looking at here for the actual budget amount. You can see the big increase has been in health and human services, with that secondary increase being in the criminal justice area, and the rest of the divisions kind of making up that area underneath there. Then we have our historic levy funding by division. And there's a little switch here where criminal justice has been the biggest levy driver, with health and human services not being as big. And then actually management and budget being kind of that next area, a lot of that driven actually in IT costs, as you look at it. So as we tell our new employees, the reason you're seeing criminal justice as that bigger area is that's the place nobody pays us to do that work, right? That's all on the levy. It's part of the original purpose that we are here and founded for. Next area is looking at health and human services major funding sources. So this again has the Scott County Health and Human Services budget. And then we have the history of funding sources. So we have Minnesota Department of Human Services. We have the U.S. Health and Human Services. We have DOC in there, Minnesota Department of Health, D kind of right there at the bottom. But as you can see, Health and Human Services, the levy that Scott County puts into this is really the biggest funding source for any single kind of department within here. If you look back at what DHS was paying us, they actually went down pretty substantially in 2007 and didn't really get back up to their 2006 levels until the 2019-2020 timeframe. But that's been relatively flat, honestly, in terms of their funding. As you can see, it's kind of hard to see, but if you look at that trend line, it's a little bit more pinched in 2004, and it started to widen a little bit with the amount that's the levy. Kind of the opposite story with U.S. Health and Human Services, which has had a pretty consistent trend line increase for what they fund in terms of our program. So they tend to keep up a little bit more. Health and Human Services, as we know, or DHS, as we know, is a little bit more up and down, but that trend has been kind of having a smaller and smaller chunk of this increase as part of the budget.
So Barb, in that story, part of that is the federal government actually bases it on true cost versus just capping a number, right?
Right, they're uncapped with our federal financial participation for income maintenance. Even our targeted case management tends to be adjusted based on actual costs and what we submit, where we tend to get state allocations that remain flat for decades.
So how we show that or talk about it is part of this story we keep talking about, right? Jake,
right.
Danny,
if you were a business, no business would operate off of a revenue source that was remained flat for decades.
When you know the cost going.
Right.
But that's something we're trying to push against right now with the United States, is that's a big change coming forward in 27 and 28, and this could look very different. The trend line I would say really is different for 27, 28.
And we're trying to use very solid real numbers. So the reason you only have through 2023 for the revenue sources is this is our actual revenue by these areas. And then the other numbers are the actual budgets and levies that were adopted in here, so.
And Joe here, I brought him in to hear what you have to say because he's helping Danny and I put this together to tell a story.
So adopted, not.
It's not the actuals looking back. This is the adopted budget and levy that we looked at.
So is one of the things you'd like to see the.
Well, I always care about actuals more than adopted. Don't we? I mean, don't we?
We do care about actuals, but we also adjust our budget every year based on the previous year's actuals. And there's a lot of things, there's a lot of noise in the actuals as well that have to go through. So yes, we can look at the actuals, like that's something we have.
Yeah, I get it. It's not an either or, but like sometimes, like what I budgeted to spend, I don't care about as much as what I actually spent.
Right. Both are good to look at, I think, right? Because one is hopefully we're doing with some amount of accuracy when we're budgeting, and then, but the other, they fluctuate based off, sometimes we get 3 payments in one year.
Yeah,
5 in
I get
another.
it. You have to have 42 footnotes for the actuals.
Yep.
That's the issue, right? Where the budget, we can pull that from your action in December, right? The actual employee counts, the actual budget you've authorized.
And we honestly have most of the actuals pulled for all of this because we've showed some of that historical before. So it'd be easy to pull in and then say, what is the story we have to identify? So it's hard to tell for every area of the organization all the time, but that's where we're getting into. This is where we get into some of this and where do we need to tell the rest of the story. So this is our childcare licensing budget to levy. So the blue line is the budget and the orange line is the levy. We've known childcare licensing has largely been on the county for some time, but in 2014, the costs doubled approximately, a little bit more. And now we're sitting at substantially more cost by 2025. And it feels to me like that gap has narrowed in terms of how much we're covering versus how much was being covered by other outside revenue sources.
This is a mandated service.
Right, but this one just floors me too, because the number that we're licensing has decreased tremendously over that same period.
We have recently taken some open positions and moved those into areas of high need.
Next area is children's mental health budget to levy. We need to do some more digging in the 2026. My initial kind of thought on this was possibly there's related to how we were billing out some CCBHC services. We're shown as an expense here for the Seeger and then the CCBHC costs.
Out of home placement.
There's some things, again, we were talking about that, setting up the enterprise services for.
Oh, okay. So.
Barb has not seen this, so she's doing any responding to this absolutely cold.
So one of the things as we move, as you're saying, like we're moving to having an enterprise system for the mental health center, we have to recognize what used to be the schooling mental health. We actually have to recognize that in our social services. So that's a
change. This wasn't
it's not like we,
That was budgeted in a different slide later, so we can't say that happened.
And the state's actually making us do this, recognize it here, so.
So that's the reason for this and in adult mental health, you'll see that shift in this out year because we're going, nope, we're recognizing it here. And then children's mental health and adult mental health is purchasing services from our enterprise fund in the mental health center. And so that's where you see that increase.
So what we want to really show is some of that case management and where those costs that are mandated and how we do it, the state isn't picking up a share of those costs.
Yeah, and maybe we want to remove we can talk about that.
That's why I said there's cleanup to do, but if we're finding it's telling some stories and helping us understand why we got here.
But even if you just look at 25 to, that's stunning enough.
The increase percentage is going, this was one as you look across health and human services that was going up dramatically fast in the cost of our levy in this and the budget for this as well. Next area, adult mental health. So some of the same things. Our levy's a little bit flatter here, but again, it's driving our cost, our overall budget in accounting, which has an impact on our levy because we have to actually have more in our fund balance in order to cover costs as we have a bigger and bigger levy. And this one, the last couple of years have been bigger increases since what, 2022?
Yeah, the other thing that will be great about Workday is that housing exploded between 2022 and 2026. And so some of this was like direct pass-through of services, like straight to cap that we were able to contract. And so that'll be pulled out of some of our budgeting pieces moving forward, which I think Tanya and I are super excited about.
Very, very excited.
Very excited.
But that's, it makes this look a little weird, like, yeah, that's not the
But the
story.
point of, the good story here, I think, is in 2022, the drop, that's why we put mental health in. You could see it coming up and coming up again, our share, as the increase was, if you look at that line, the slope. But there was work to get a 1969 formula changed when AMC went at it, right?
Yep.
And that helped. So to me, this was a positive story we should be talking about.
I agree, and even if you think about to be a continuum that Tanya showed for youth, same thing for adults, and you think about the ERTs that we have here, you think about how we've supported different mental health programming, and we aren't seeing some of our state hospital costs, even though the daily cost has escalated for us, the overall cost hasn't escalated.
But again, it was work.
Yep.
People came together, they're looking at things like this, why are we picking up such a huge part of it? It's dropped down, and hopefully once we get the housing and the other things out of there and fixed, it will look better, that working together, we can make some changes.
Yep.
Next area is developmental disabilities. This is one that's been, in terms of the budget, fairly chaotic. But we have a pretty healthy trend line of the levy going up of this. And right now we're sitting at quite a bit more percentage of this. Actually, if you look back at 2007, the budget is less than it is, or is more than it is in 2025. But we've increased by $1 million in terms of the levy funding going into this area.
What's that big jump? Like $500,000 jump last year? That should be explainable.
Yeah, so a couple of things come to mind for me is, one, we took case management, we took individuals that were budgeted in case management, and we moved them into MinChoices, and then that's when we didn't get the reimbursement. And so some of that was a shift within that, which I believe that we've rectified some of that. Some of the changes here, I think, are due to, like, the rates just haven't increased for some of our staffing. This too will be one that I am excited to see. Another piece is that we changed our case management. We were getting some of the administrative reimbursement, and we had to, I think that was the biggest.
That's just a crazy change in 1 year, so there had to be some more behind it.
Yeah, I think that's when we came here and said there would be a loss in revenue due to that.
I think the Workday will help with some cleanup on this one too, because we don't have just a developmental disability team. It's case management.
Right.
And so this really is a portion of the former HCC budget. So now it'll all be combined. This will make much more sense. Because this team actually does different types of waiver case management, but only the revenue for DD case management shows up here.
Okay.
So it's messy right now, but it's cleaned up, will be cleaned up moving forward.
Yeah, I think looking at those and making sure that these buckets are the right buckets, because to me,
now they are.
Okay.
This is where we couldn't break it down to the specifics, and Workday will.
Right.
But still, the point here is $1 million increase to the county, no matter what you're talking about. And a drop at the other point, right? And so it doesn't matter what the buckets are, these are real levy dollars.
Well, I understand that, but I think when we're taking one bucket, sometimes these were levy dollars that were in a different bucket. Like, that's what I'm hearing on these first couple of slides with the change and, with children's mental health it was, right?
That one was.
Yeah, that one was.
Yeah.
Not here.
But that was the budget dollars, not the levy.
Yes.
The levy dollars stayed there, the
Right.
budget dollars moved. And with this one, yes, there is some mixing with home and community care, and this is something that I know they've worked to clean up
Yeah.
a lot and worked very hard. But when you look back at the history, and that's where we're pulling this history, it was being accounted for very similarly for a long time. And so the change in funding and levy, when you look back, is still telling an accurate story. We are just being able to tell that story and how it mixes more accurately with how we've broken it up in the future.
So moving forward, you'd still be able to combine these and see the total. But the point is the change in who's funding the programs.
Sure.
And I would argue that as the lead agency, even though like we are over a contracted case management, the fact that we don't get an admin cut anymore for
Right.
that.
That's huge.
Right.
There's no admin.
There's no admin.
Why would you want an admin cut? You keep telling me there's no admin costs. Why do we have to account for that?
All of
We
us,
don't have to do anything as a lead agency.
we do nothing.
So this one tells a story that we were trying to get at, about the Minnesota Department of Corrections funding for this, where the levy doesn't cover quite as much. Some of this is, you see that huge jump and all of a sudden we're seeing budget versus actuals be a lot closer there than practicality, and that shows some of the noise in the actuals versus budgeting area. What I would say here though is that, yep, we got a funding increase, but we also see that budget jump dramatically. This wasn't, and it offset us for some, but we're already jumping up in the terms of the percentage of levy that's being covered here, or the levy dollar amounts that we were covering. It's continuing to go up in future years. And so it took off some of our costs, but we're gonna get back up to it really quickly. And it was more, we added requirements, added services, not covered the county's cost for what we're doing as much as we would like.
Where's that green line? Why did it stop there at 23?
Because that's the end of our ACPR with the revenue projections we had. And then we have budget going forward. So this will be one that we continue to update.
Well, I think we have to continue to watch this. I watch this every month, like having less people on probation should make a difference.
I think Barb informed the chair, vice chair this morning.
Yeah, Molly had gotten some really preliminary numbers from Matt Cook yesterday, and at where we're sitting right now, we are probably looking at like a $388,000 loss beginning in July 1st of next year. So for the 27 budget, like an additional $190,000 that we'll have to account for. So
In the 27 budget.
yeah, in the 27 budget.
And then pick up the rest in 28.
Yeah.
So I think, that gets back to a level of service
Right,
discussion.
exactly, exactly.
Right, unless we're successful with the funding formula, but I think,
Yeah. But yeah, I think it's a level of service discussion, especially as we see less people on the caseload.
But we also know when we didn't fund that one right, we saw ours, right, when we overlay now the outcomes.
Right.
You
Way,
saw
way
it,
different.
right? It looked different. And so we have to overlay some of these outcomes with these programs as well, which is part of the trick now of some of these measures and how they look on here. But I think corrections was one, when you decided to invest, hopefully we start to see in the next 2 to 3 years, we'll be above that 90% again, staying clean for at least 3 years, which is the target goal. But I mean, we also lose the fees in 29, so that's another 400 and some thousand. So between that and this cut of 360, you're looking at about 700, you're looking at almost a percent of levy by the time you get to 29.
So those were the ones that we had pulled out to kind of just start sharing what we were working on and get some initial feedback on, which I think we have, where we need to dial it in.
So probably some actuals you'd like to see in there.
Well, or at least, or to confirm that at least when there's a story to tell with the actuals. And I think when there's a story about the shifting that Barb brought up.
Yep.
And I'd like to, because maybe this is gonna be our year to really work on children's mental health. We've talked about it a lot. And if we're gonna go, we gotta be ready to go by like September so we can convince the rest of the state to do it.
Yep.
I I would just, I think with the administrators, do you have any, do their graphs look the same? And if not, we should know why. But let's start socializing that if that's, we've been talking about it, we see it's a big one.
So that's 2 emails I'm gonna send out here in the next week, will be a couple of these graphs we've been working on. And then MELSA, so Jake finished the Biker paper on MELSA. It's about $1.25 million that just with no effort could come back to the 8 library systems. And so that's one I'm gonna send out to the administrators as well, based on the AMC meeting.
What would be our percentage of that if we just used our percentage of?
I didn't even get into what it was.
150 grand or something, because.
Maybe not even that much,
Yeah.
I don't know.
I just want to keep that in mind with how much time we spend on it, so,
Right,
yeah.
but a little white paper doesn't take.
No, perfect, and yeah, we haven't included the administrators the last couple of years, as we should have, that's my fault.
So there's some things there, but children's mental health is one. I think the whole children's welfare and this cap at 16 that you talked about at the board, that's concerning, but that's the difference between the federal and the state when they're funding. Most states are 50%, and in Minnesota, it's what?
The national average for property tax to fund child welfare is about 10%, and we're at about somewhere between 41 and 40.
With child welfare and with probation, we're both down there.
Yeah.
Yeah, everybody's been
And staff.
bemoaning corrections a little bit, except Carver, but their costs, they will acknowledge, have gone up a little bit, but not near as much as ours. So we're on the right track, we'll keep refining this and taking a look at it. I wanted to bring solid waste in, that's another one. What does that assessment look like versus what the state's funding? I think you're gonna see that's gone up. Y score maybe is a discussion. Transportation. I think we'll pull out the leased motor vehicle sales tax. I am concerned about that and some of our partners to the west that aren't in the metro.